Basil Butcher, your brain-based movement conditioning coach. Today we're going to talk about an issue of knee pain on the inside of the knee. I'm going to use a chair to demonstrate the first sitting down. This area right here is called the pes anserine. 3 tendons from 3 different muscles merge and form the pes anserine. There's a bursa underneath these tendons that can become inflamed. And these 3 muscles are the sartorius, the gracilis, and the hamstring muscle, the semitendinosus. Now, the first thing I'm going to do is there's an area here on this, in this muscle right here, that can be very tender, right? Because there's a lot of things that go through arteries, veins, nerves, all pass through an area that can become congested, which can affect the inner part of the knee. How you find it? You find the joint where the 2 bones, the bone, the tibia, and the femur bones that form the knee. You'll put your pinky finger at the joint, 4 finger widths, and then you'll then move your fingers or your thumbs around. You find a area here that is tender, or if your fingers are sensitive, you'll feel a little hole in this area, tiny hole. So you would put your fingers on that fascia around the hole and pull them apart, like I'm doing. I'm pulling them apart, and you may feel, if your thumbs are really sensitive, you'll feel your thumbs moving back and forth. And once they stop moving, that is the point where, the area should have released. Now we're going to move on to the nerves that affect this area, that can be to get this area moving better, get these muscles, the good information getting sent from the joint through the peripheral nerves. And there are 3 nerves we're going to look at. We're going to look at the tibia, the tibial nerve, the femoral nerve, and the saphenous nerve. So I'm going to demonstrate the first one sitting for the tibial nerve. So my knee is locked. I pull my ankle up. Pull my ankle up, dorsiflexion. I rotate my ankle out. Hold that position. What you can do is you can do this against the wall, so you can hold that position, right? Then I'm going to move forward like that, straight, bring my trunk forward. I'll feel a stretch. On a scale of 1 to 10, a 3, and then I'm going to flex to feel even more tension, put more tension on the nerve. Again, on a scale of 1 to 10, a 3, and I hold that position for 5 seconds. Repeat that 5 times. Then the next one is the femoral nerve. You'll get into a lunge position. I'll show you from the side what the lunge position looks like, and then I'll show you frontal what you do. So you're in the lunge position. You stretch, so you feel that stretch straight down here. Then you posterior tilt. And I'm going to use this chair as a prop because many people lose their balance while doing this. You hold that position. You rotate your trunk to the front leg. And then you flex. And you feel that stretch. Again, on a scale of 1 to 10. I'll do it from the front. Right? It's fully stretched. I posterior tilt my pelvis, rotate to the front leg, and flex over. Again, on a scale of 1 to 10, 3. right? And that is for the femoral nerve. Now we're going to use the saphenous nerve, do the saphenous nerve. I'm using this to keep the working leg ankle in dorsiflexion. So, I have it at an angle. This is the working leg. The ball of my feet are up there. You can use a book or what have you. And the other leg, so I'm like at a 45 lunge. I then rotate my pelvis, keep my knees locked. You'll feel a stretch straight down the inside of your leg, right? Just like I did before. Holding this position, I rotate towards the front leg, and then I flex. On a scale of 1 to 10, 3. And you'll feel a sensation right down your leg. Now, for that specific area, the pes anserine, to be more specific, what I could do is rotate my foot on this thing. So I'm rotating onto towards my big toe with my foot, so I can get more sensation directly to the pes anserine. Again, on a scale of 1 to 10, 3. I'm going to do the part 2 when we're actually going to engage those muscles.